I'm Dr. Art Uleen. Your doctor has given you this program because you or someone you care about have osteoarthritis, and your doctor wants you to understand as much as possible about this condition and how it is treated. There are many different kinds of arthritis. Osteoarthritis is the most common, affecting millions of people. Osteoarthritis is sometimes called degenerative joint disease. What that means is that tissue within the joint is gradually breaking down. Many people think there's nothing you can do about arthritis, but that's wrong. We'll show you how people with osteoarthritis can relieve their pain and stiffness and help themselves feel better. Although osteoarthritis can cause serious pain and disability, many people have a mild form of the disease with few or no symptoms. This program is mainly for those in between, people who do have some joint pain or stiffness, but not enough to be considered severe or incapacitating. We'll call it mild to moderate osteoarthritis. For starters, let's meet some people who have it, but have not allowed it to dominate their lives. Joyce has osteoarthritis in the feet and spine. It hasn't stopped her from square dancing several times a month as a member of a square dance club. Maxine has osteoarthritis in both hands, yet she knits and crochets anything from baby blankets to bedspreads. Larry's osteoarthritis is in one ankle, but he works out regularly on a treadmill and holds down a job that keeps him on his feet much of the day. Kim's osteoarthritis is in the hip, but she manages to swim every day and keep up a busy retirement schedule. Neil, who teaches American history, has osteoarthritis in the neck and spine. He also coaches his high school lacrosse team and continues to play the game himself. Susan has osteoarthritis in the neck, hips, and back. She still takes long bike rides on the weekends and works full-time managing a business office. 6 people, all with mild to moderate osteoarthritis, all leading full and productive lives. Osteoarthritis can develop in any joint, but the knee is one of the most frequent locations, especially in women. A joint is where 2 bones meet. In the case of the knee, the femur or thigh bone meets the tibia or leg bone. The ends of the 2 bones are covered with cartilage, a material that is firm but resilient. The cartilage prevents direct contact between the 2 bones, acting as a cushion or shock absorber. In a healthy joint, the surface of the cartilage is intact and smooth, allowing the bones to slide easily on each other. The entire structure of the joint is enclosed by a sac called the synovial membrane, which releases a thick fluid to keep the surface of the cartilage lubricated. When it's healthy, a joint can withstand unusual stresses and pressures without discomfort. When disease strikes, it may become a source of pain with the slightest movement. For an explanation of what happens inside a joint when osteoarthritis occurs, here's Dr. William Arnold.
Osteoarthritis may actually progress very slowly. While we usually think of osteoarthritis as a disease only old people get, in fact, the basic process can begin at an early age, but often becomes manifest only later in life. With progression of the disease, the cartilage gradually deteriorates. First, the smooth surface of the cartilage becomes pitted and frayed due to a loss of resiliency. It's now more vulnerable to damage from overuse or injury. Over time, areas of cartilage may be worn away completely. This exposes the underlying bone and causes pain when the joint is in motion. Also, the synovial membrane may become inflamed, causing swelling and adding to the pain and stiffness. In the majority of people with osteoarthritis, quite frankly, we really can't identify why they get the disease. In certain athletes, for instance, the cause is obvious. Injuries to their knees leads to the early development of arthritis and often forces a premature end to their career. We've discovered that there are genetic influences passed from one family member to another that can lead or predispose to the development of osteoarthritis. In addition, overweight, something I think we've suspected for many years as predisposing to the illness, has finally been proven to predispose to osteoarthritis. So all the advice that we hear constantly about exercise and maintain your weight with an appropriate and nutritious diet, we should pay attention to that because it could help us avoid osteoarthritis.
As Dr. Arnold said, most of the time we really don't know what causes osteoarthritis. Some people can link it directly to a previous injury. For others, the pain cannot be associated with anything specific. They just know that the pain is there.
I've had back trouble for about 25 years, but I've never had the name osteoarthritis connected to it until quite recently.
I was training for the marathon, and we trained every week. And each week we would increase our mileage by a mile. Well, I got through 13 miles, 14 miles. When I got to 16 miles, there was something wrong with my hip. And I kept thinking it would go away, so I kept running. But eventually it got so painful that I had to go to the doctor. And that was when I was diagnosed as having osteoarthritis in my left hip.
I sprained my ankle, and after about a year of being pain-free, I began to experience pain and discomfort in my ankle again. That's when I went to the doctor, and I was diagnosed as having osteoarthritis.
I fractured my foot. It was a slight fracture, but nevertheless, it did cause me a lot of pain. They said that the healing would take longer, but it would be a matter of a month or two.
5 or 6 years ago, I started getting various aches and pains. I was a jogger, and I did aerobics, and I did heavy weight workouts. And so that's what I thought it was. And so I didn't do much about it.
It did not seem to be mending correctly, and I was still having a lot of pain with it. The doctors did more of a study on it to find out why I had not been healing at a better rate when they discovered that I had osteoarthritis.
When the doctor gave me the diagnosis of osteoarthritis, I was rather surprised because I thought this was something that I wouldn't be diagnosed with until I was much older.
These people have done the right thing by seeing their physicians, getting an accurate diagnosis, and working closely with their doctors on their therapy. Some people delay going to the doctor because their symptoms are so subtle that they don't think they're important. Others delay going to the doctor because the reality of osteoarthritis is hard for them to accept. They associate it with old age, or they're afraid it may disfigure or cripple them, or they just can't admit that something has gone wrong with an otherwise healthy body. So they deny it to themselves and refuse to seek medical attention. That's unfortunate because the earlier osteoarthritis is recognized and treated, the better it can be managed. Even though it can't be cured, there are things you can do to minimize the discomfort and, often, prevent the disability that otherwise might occur. That's why it's so important to follow your doctor's advice and take an active role in your therapy. The symptoms usually begin slowly, with mild aching or soreness in the joint, especially when it's moving. Symptoms may differ, however, from one joint to another. In a knee, along with pain and tenderness, there may be a grating or crackling sensation when the joint is moved. It may be especially difficult to walk up and down hills or stairs. In the fingers, there may be swelling of the end joints and middle joints, and sometimes pain. In the feet, the first symptom usually is pain in the large joint of the big toe. In a hip, the pain may be referred, which means that it's felt at a different location, such as the buttocks, the knee, or the groin or inner thigh, or along the side of the thigh. Osteoarthritis of the spine may cause pain over the spine itself, or may be referred to the head, the arms, or into the legs. Any of these symptoms could be confused with symptoms caused by other disorders, so it's important to see a physician and get an accurate diagnosis.
Some of the other causes of pain in or around a joint which could mimic osteoarthritis might be related to tendonitis or bursitis, or a muscle pull or a muscle strain. For instance, if an individual overused the joint, gardening or cleaning windows or playing in a sporting activity, it's usually very easy for a person to identify that that's the cause of their pain. Sometimes if you bump your knee, you can identify that. But quite frankly, if a pain has been persistent, greater than a week or two, and it doesn't seem to go away and there's no specific thing that a person can identify, to get a real diagnosis requires a careful history and physical examination. often x-rays taken in a physician's office. Have you had any time of the day when the pain is better or worse? For instance, how does your knee feel when you get out of bed in the morning?
Well, then it's quite painful.
Okay. In making the diagnosis of osteoarthritis, I begin by talking to the patient, by asking the patient about their pain. When does it occur? Where does it occur? How severe is it? What makes it better? What makes the pain worse? This helps me also to guide my physical examination. Can you tell me if there's any tenderness or pain anywhere?
No, there's
No
none.
pain. Okay. How about out on this side? Is there pain here?
None.
All right. And down here?
Nothing.
Excellent. Now I'm going to hold your knee here.
That-
Ooh, that was painful, wasn't it? I felt
Yes.
that.
Uh-huh.
Sure. In the physical examination, I look for signs of swelling around the joint. Is the swelling fluid? Is it soft tissue, which can be inflamed? Is it bony hard, which means the joint is repairing itself? Now you keep your knee nice and straight, and I'm going to try to bend it. Don't let me bend it. Very good. I look and see if the knee can move through a full range of motion, and if there's any tender spots where I touch it. Following completion of the history and physical, we usually take x-rays to confirm the diagnosis. Let's look at the x-rays that you brought with you from your doctor. Maybe that could give us some additional information as to what's causing your knee pain. On the x-ray, we look for signs of narrowing of the joint space, indicating loss of the cartilage. Now, normally, between the two bones, there should be a clear space here in the inside part, just like out here on the outside part. That clear space is actually the cartilage that covers the ends of these bones. So that when the bones are so close together as in this case, what happens is the cartilage has been lost. You can also see a couple of other things here that are characteristic of osteoarthritis, and that is the whitening of the bone. See how white that bone is, right where the two bones are meeting there?
Yes.
Normally it doesn't get like that. You can see on this side here the bones aren't nearly that white. That's called sclerosis. And what's happening here is because the cartilage is gone, the bone is trying to become stronger, because when you walk, it rubs right on, one on each other. And that whitening is a reaction of your body to try to protect that. Also, you don't see it very well, but right here on the corner, the bone, besides being white, is also trying to get larger, and it's forming a bone spur. So taken as a whole, the presence of this spur, the whitening of the bone, the narrowing of the joint here due to loss of cartilage, this x-ray, together with your exam and the history, really is pretty convincing evidence that your pain is caused by osteoarthritis. It's really after these three steps that in most patients we can arrive at a diagnosis of osteoarthritis and plan our course of treatment.
For people with mild to moderate osteoarthritis, treatment usually consists of a combination of exercise, medication, and rest. Exercise keeps joints flexible and strong and makes you feel better generally.
The doctors prescribed certain exercises for me to do with my foot, but I've found that the best exercise was walking. And of course my aim was to strengthen my feet to where I would be able to dance again. My husband and I dance at least 2 or 3 times a week. We ballroom dance, square dance, round dance. I definitely feel that the exercise that I get in my dancing does help to keep the osteoarthritis at a standstill.
I exercise because that helps, and I have those exercises from the doctor in my self-help book for arthritis, and you bend the first joints and you bend down to your knuckles, and it hurts, but it's worth it. And then you bend up from the knuckles and you bend all the way up and open your hands like that, and that does relieve the stiffness. And I do it with both hands, and I do it when I'm walking, when I'm driving, whenever I think about it.
I go to the pool every day to swim. I usually do laps at first, and then I do different water exercises, and then I finish by doing some more laps. And when I get out, I really feel great. My leg doesn't hurt, and everything is just fine. Swimming for me has been just fantastic. I love it.
I've knitted and crocheted for years, and I've found that it helps a great deal with my osteoarthritis because my fingers get stiff. And the activity of crocheting and knitting helps keep them limber.
This is good exercise. You feel so free and pain-free. And when you get done, it really feels good. When I'm actually riding, nothing hurts. The only change I make is sometimes I sit up straighter when my neck and shoulders get tight. But this is a way to move with ease and no pain, and to just forget about everything and have fun. If I'm uncomfortable and I go out and I bike, when I come back I feel much better.
I try and walk about 2 miles per day. Walking on the treadmill makes me feel good. I walk on this treadmill because it strengthens my ankle. The more I walk, the looser it gets.
I like to play lacrosse because it's the one sport where the fact that I'm not huge, not tall, not fast, has not eliminated the possibility that I can play. Forget the osteoarthritis. I can still play this game, and that's why I like it.
If you're overweight, regular physical activity can help you get the extra weight off. Depending on which joints are involved, your doctor may caution you against certain kinds of activity. Distance running or jogging, for example, if the knees or hips are affected. You may be asked to do some specific exercises designed to increase the strength and flexibility of particular joints. We asked exercise physiologist Diane Edwards to show you a few that anyone can do at home, with no need for special equipment or clothing.
Now let's talk first about flexibility. When increasing joint flexibility, the important thing to remember is to go slowly and to hold the joint in an extended position, such as working on the shoulder. If you grab hold of your hand and pull your arm across your chest and gently pull, you can feel a gentle stretching motion in your shoulder. Hold that position for a period of time, and you will increase flexibility in the shoulder without actually moving the shoulder joint. Flexibility in the hip. Lean forward, grab hold of your legs, and pull your chest as close to your thighs as you can, and hold that extended position for a period of time, increasing, again, the flexibility in the hips. Think then about how would we strengthen those muscles around the shoulder. Taking hold of, say, a pound of rice or beans, or even a small hand weight, pulling your hand up to your shoulder, isolating the shoulder so that it doesn't move. It's going to make the upper arm stronger, but it's not moving the joint. Now, how are we going to strengthen the muscles supporting the knee without moving the knee joint? How about if we sit in the chair and we straighten out the knee, and then we allow the leg to come up, the thigh to come up off of the chair, and hold that position for a few seconds, and then put it back down, and then lift it and hold, and put it back down. Now, in addition to that, I would suggest we take a look at some type of endurance activity. Endurance activities are rhythmical and continuous. Swimming in the water is a good one. What about cycling? And if you don't have an outdoors bicycle or care to do that, what about an indoor exercycle? Walking is always a very good way. It doesn't have to be on a treadmill. You could do it outside and just start slowly. Remember, when you begin an exercise program, pick something that you really enjoy doing. Start at it slowly, but do it regularly, and you will really be doing something to help your arthritis.
Once you finish viewing this program, go back to the exercise segment and practice some of the routines Diane demonstrated. Just do 1 or 2 repetitions of each exercise at first, then gradually build up the number. A word of caution, however, if you feel pain during any of these exercises, stop doing them and discuss it with your doctor. Osteoarthritis can make it difficult to continue some of your customary activities, but there are lots of tricks that can help you get around problems. Here's what some of the real experts are doing.
To brush my teeth, I use an electric toothbrush because that makes it much easier than having to go up and down like that. It does the work for me, and that is a big help.
Chairs are death for someone with a miserable spine, and I don't sit in them too long in my work, and that's made me a happier person.
I went to the doctor because I was still having some problems with pain, with tiredness caused by my feet and the osteoarthritis. They came up with a support device, which I wear all day long, and this does help me so much so that at night I can wear my dancing shoes without any problem at all.
One of the things that helps me with my bike riding is that my handlebars on my bike are high rather than the low ones, and it keeps me straighter and more comfortable and less stress on my shoulders and my neck.
In addition to exercise, your doctor may suggest using heat or cold applications for temporary relief of joint pain and inflammation. Heat and cold therapy should be used only under the guidance of your doctor or a physical therapist. People with mild to moderate osteoarthritis ordinarily don't need special devices to assist them in their daily activities. Occasionally, an assistive device, such as a large handle on a tool, may help protect a joint from further injury. For most people, it's usually sufficient just to modify the way they do things to avoid unnecessary stress on the affected joint. Often, medication is necessary to cope with the pain and swelling of osteoarthritis. There are several kinds of drugs your doctor may prescribe, alone or in combination. A class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs for short, may be used to relieve pain and reduce joint swelling and inflammation. Analgesics, such as acetaminophen, may also be prescribed for pain relief, but usually in combination with an NSAID to reduce the inflammation.
The doctor prescribed anti-inflammatory medication because I did have a lot of swelling. And at work, I kept my foot elevated per doctor's instructions, which also helped to keep the swelling down. And then at night, I would use the cold compresses.
I was given anti-inflammatories to treat the inflammation in my ankle. What that did, it relieved the pain, the throbbing pain that I had when I walked. And in essence, I was able to use my ankle in the manner it was supposed to be used.
Most people respond quickly to oral medications. However, the time it takes for a drug to take effect may vary from one person to another. Your doctor may also recommend additional therapies, such as the injection of an affected joint with corticosteroid drugs. Whatever therapy the doctor prescribes, the more closely you follow the doctor's recommendations, the more likely it is to work for you.
In order to obtain the best results from any treatment regimen for patients with osteoarthritis, it's really very important that people comply with all aspects of the therapeutic program. People must exercise, take their medications, rest on a regular daily basis in order to get optimum pain relief. Particularly with medications, the level that the medication reaches in the bloodstream is dependent upon how regular the person takes the dosage. So it must be taken on a regular basis every day so that the medication can achieve a level such that it gives pain relief. If people don't do that, well, they might think that the medicine's not working, when in fact they're really not giving it a chance. So that taking medication on a regular basis, doing exercise, and really complying as much as possible with the prescribed regimen will guarantee the maximum benefit.
It really pays to take an active role in the treatment of your osteoarthritis. It's the best way to maintain a full and productive life. Here's living proof of that.
Osteoarthritis is definitely a part of my everyday life, but it hasn't changed the way I live all that much. I work, I hold down a full-time job, I travel, I do my exercise activities, and although there are good days and bad days, you work around the bad days, and there are more good days than bad days.
I knew that I had to make the best of it because this is a lifetime thing. Once you get arthritis, it's there. So I decided I would exercise and do whatever I could to not become stiff and immobile. I decided I can't let arthritis interfere with my life, so that I exercise and I knit and I just keep active because I know that that alleviates the stiffness and I won't become just a couch potato. I'm not going to let that happen.
As long as I keep getting my, regular treatments and getting my exercise, it hasn't stopped me from going fishing and doing all the things that I like to do. So I don't think there's going to be any problem with it.
I know I have a condition that could be really serious, but as far as I'm concerned, it hasn't slowed me down. It hasn't limited the way I'm living, and I feel very strongly that exercise and keeping active is very important. I think I've overcome it, and I know that it does not have to interfere with the way I live my life.
Sure, I've got osteoarthritis, but I'm not going to let it define my choices. I'm still in charge. I still define my choices. I make compromises with the disease, but I don't give in to the disease.
I just made up my mind that I wasn't going to let this osteoarthritis get me down and keep me down. When we plan on going dancing, square dancing in the evening, osteoarthritis can be acting up, and you kind of think, oh, gee, maybe we shouldn't go tonight. But by the time you get there and the people, the music, the dancing, by the end of the evening, you forget all about it and you leave just feeling great.